just clean my hands. My name is Kaylee and I will be your nurse practitioner student today. We will be performing a lung, cardiac, peripheral vascular, and abdominal assessment. Is this okay?
Yes, it is.
Perfect. My patient is alert and oriented, seems content and comfortable with no signs of pain or respiratory distress. So I will start by looking at your back and your front. We'll do some palpation and then we'll move throughout the exam. I will let you know each part as we do it.
Okay.
So let's just move this here closer. If you can just kind of turn your body just a little bit. Yep, perfect. I will just start by looking at the posterior back. The posterior back is symmetrical. There are no deformities or lesions, bruisings, abnormal colors noted. So now I will move on to assessing the thoracic expansion. I will put my hands on your lower back while you take a deep breath, and I am just assessing for equal expansion and how much expansion occurs with that. So I'll just put my hands down here and you'll take a deep breath. Perfect, and then one more for me. Awesome. The chest expansion is equal, about 5 centimeters each side, which is normal. And then I will assess for tactile phlebitis. With this, you will continuously say the number 99 as I move my hands to different portions of your chest. This is just assessing that the vibrations are equal. So I will start here.
99, 99, 99, 99, 99.
Okay, and you can stop. Vibrations are equal, which is a normal finding. Now I will percuss in different spots of your back. I am just assessing the sounds that your lungs make with this light tapping. So, just a light tapping. The sound is resonant, which is a normal finding for the lungs. And now I will move on to listening with my stethoscope. With each movement, I will just ask that you take a deep breath. If you need a break, just let me know. All right, whenever you're ready. Perfect. Lung sounds are clear and equal bilaterally with no adventitious sounds noted. And now I will move on to assessing from the front side. Chest is symmetrical with no deformity or discoloration noted. There is no use of accessory muscles to breathe. And I will do the same with listening with my stethoscope. Just taking a deep breath with each movement again.
Okay.
Alright, that is done. Lung sounds again are clear and equal bilaterally with no adventitious sounds noted. Now I will move on to the cardiac assessment. Still doing okay?
Yes.
Okay. We will start with your carotid arteries, which are the arteries in your neck. I will listen to those first, listen for bruits, which is just abnormal flow of the blood, and then I will palpate both of those arteries.
Okay.
palpate those. Palpation is normal, 2+, which is brisk, and no bruise noted with auscultation. Now, if you would like, we can lay down and we'll finish the cardiac assessment and do the abdominal assessment. So first, actually before I do that, I will just assess the precordium, which is the cardiac area. I will just palpate in a few different spots. We'll just start with that. And then I will find the apical pulse, which is the 5th intercostal space, mid-clavicular line. It's the apical pulse. There is no thrills, heaves, lifts noted. Now I will listen to the heart sounds. We'll start with the diaphragm and then we'll move to the bell. I will just tell each spot as we go. We will start with the aortic area, the pulmonic area, Erb's point, the tricuspid area, and the mitral area. Now we will do the same with the diaphragm of the bell of the stethoscope, the aortic area, pulmonic, Erb's point, tricuspid area, and the mitral area. Heart rhythm is regular. Now we'll move on to the abdomen. The abdomen is symmetrical with no scarring or discoloration. I will listen to the abdomen and then listen to some arteries before we move into palpation and percussion of the abdomen. Okay. I will start with listening in the lower quadrant. Bowel sounds are normal active, which is a normal finding. And then I will listen to a couple arteries. We'll start with the aortic. The renal arteries. The iliac arteries on both sides. And the femoral arteries. There are no bruits noted, which is a normal finding. And now I will percuss each quadrant of the abdomen. We're just listening for sound to see if there's fluid, air in those organs. The sound is tympany, which is a normal finding for the abdomen. So now I will palpate each quadrant. Just let me know if there's any pain or tenderness. We're looking for masses and pain. We'll start with a light palpation and then we'll move to a deeper palpation.
Okay.
So just a light. Is there any pain or tenderness with that?
No.
Okay, perfect. And then we'll move into a little bit deeper. We're just looking for the same things. Any pain or tenderness?
No.
No pain or tenderness, which is good. That's a normal finding. And then no masses or abnormal findings with that. Now I will palpate the liver and then the spleen. So the liver will be on your right side. If you take a deep breath, inhale. Okay, there's the liver. It is not enlarged. And then we'll do the same with the spleen. Perfect. That one is also not enlarged. All normal, great findings. And then if you sit up for me, we are just going to assess for kidney infection or renal issues. And to do this, I will percuss the chordovertebral angle on your back. It should just be a light tapping, but let me know if there's any pain or tenderness with this.
Okay.
I'm gonna set my hand here. Any pain or tenderness?
No.
Awesome. So no indication of kidney infection or renal issues with that.
Okay.
Now, moving on to some pulses. Still doing okay?
Yes.
Okay, so we'll start with the radial pulses, which are on your wrist. Moving on to your brachial. Okay, and then we'll move on to your feet. The dorsalis pedis is on the top of your foot. And then the posterior tibialis is on the inside of your ankle. All pulses are equal bilaterally with a 2+ grade, which is brisk and normal. And then the last thing that I will do is assess for edema, which could indicate a vascular issue. So I'll just pull these up just a little bit so that we can kind of push on your shin just slightly. Okay, so I'll just press on your foot and your shin. There's no edema noted, which is normal, and that will conclude our exam today. Thank you for being a patient for me.
Thank you.